Hello, everybody. Welcome back to Psychedelics Today. This is your host, Kyle Buller. And today on the show, I get to chat with Dr. Stephen Radowitz, the Chief Medical Officer over at Nushama, which is a psychedelic wellness center. This is a fun episode because we actually got to record this live in person at Nushama. Their flagship center is over at 515 Madison Ave. And yeah, it was fun to finally check out the center and the site over there. Got invites about I think maybe about a year ago. About a year ago. First met Jay, one of the co-founders over there at Nushama at Wonderland, the Microdose conference last November. I've been planning to try to get over there and lots of delays because of all the travel and everything that's been going on and vital. So finally got to get over there, and we recorded this right before Horizons. So that Wednesday, right before Horizons. So I'll read a little bit about Dr. Radowitz, and then we'll get into it. So Dr. Stephen Radowitz, again, is the Chief Medical Officer of Nushama Psychedelic Wellness. And he joined Nushama to oversee and develop various treatment modalities because of his belief that psychedelic medicine is the future of mental wellness, and that current solutions treat symptoms only and do not address underlying issues. Dr. Radowitz has been practicing internal medicine and primary care since 1998 and has a passion for preventative medicine and getting to the true source of disease before it manifests. He sees the source of disease as a disease that results from misalignment of mind, body, and spirit. And he sees psychedelic medicines as a powerful tool to help become more aware of the origin of this imbalance and guide us on a path to wholeness, health, and well-being. And it was also really fun. I think it was only like a few days after I got there that I found out that Nushama had their 1-year anniversary. So happy 1-year anniversary again, everybody over at Nushama. And so in this episode, we talk about that. We talked about their accomplishments over the year, what they've learned, both some of the wins and challenges that they've had starting up this psychedelic wellness clinic. We talk about some of the protocols that they use at Nushama. They use ketamine right now. And then Dr. Radowitz and I also chat about the inner healer. One thing that he brought up during it when we asked about maybe some of the challenges or maybe the things that they've learned was also this idea of kind of getting out of the way as healers and therapists and really kind of trusting that inner healer, trusting the client, and really kind of creating that container for the client to go inward. We also chat more about ketamine and group work. They've been doing some group work over there as well. So again, it's a fun episode. If you want to learn more about Nushama, you can check them out online. That's nushama.com, nushama.com. All right, before we jump into this episode, just some reminders and updates and news. So if you haven't subscribed to the podcast yet, please subscribe wherever you listen to podcasts. Follow us on all of our social media channels. We're on Facebook, Instagram, Twitter. We got TikTok. So check us out over there if you haven't for any live updates. And also, if you haven't, consider leaving a review on iTunes or Facebook. That helps us out tremendously. And maybe other podcast apps allow reviews, and if that's so, that would be awesome as well. Some education offerings. So if you want to dive deep into the world of microdosing, we have a special class coming up that is kicking off on November 15th, and this is the Microdosing Masterclass with Adam Bramlage, with special guests, including Dr. James Fadiman. This is going to be a self-paced course, so you can take it at your own time, but there actually will be some live interactive classes that Adam and Dr. Fadiman will be hosting, so you'll be able to get some Q&A with them. That will kick off on, again, November 15th, and that's the Microdosing Masterclass. Really, really excited for this one. You can learn more about that class at psychedeliceducationcenter.com and all of our educational offerings. If you're working with clients, whether you're a licensed therapist, a coach, any sort of wellness practitioner, or maybe you're a grad student or any student that's looking to get more involved in psychedelics, kind of build that foundation and to try to kind of figure out how to navigate the field, Well, we have our Navigating Psychedelics course coming up. We have 4 groups on 2 days. We have Tuesdays and Wednesdays, and our Navigating Psychedelics for Clinicians and Therapists course kicks off on November 29th, and that goes until January 24th. So we have 4 different times that you can sign up for there, and you can find that out at psychedeliceducationcenter.com. And one more reminder around our conference Convergence. As some of you know, we had to change our dates from October to March. So the new dates are March 30th through April 2nd. This conference is taking place in Los Angeles at a place called the Wisdom. Super cool venue. I'm actually really excited about it. You can learn more and buy your ticket. Tickets are live now at psychedelicstoday.com/convergence. So I think that's it for the reminders. I hope you enjoyed this episode with Dr. Stephen Radowitz from Nushama, and we'll catch you on the other side.
Hey everyone, Alexa here again to share more info about one of my favorite mushroom treats. Mud water is a coffee alternative which provides a heart-opening mood boost coming from cacao and chai. It's basically a microdose of caffeine, so you get some energy without the anxiety or jitters. I'm super sensitive to caffeine. I quit coffee over a decade ago, and even decaf gives me a buzz, but Mud provides an even, mellow alertness that doesn't cause a crash. It's made with 4 adaptogenic mushrooms, lion's mane for focus, cordyceps for physical performance, and chaga and reishi to support the immune system. You can try it for yourself at mudwater.com/psychedelics, spelled out mud, MUDWTR. You can also use code psychedelics for 15% off, and we can't wait to hear what you think.
All right. Dr. Stephen Radowitz from Nushama. Welcome to Psychedelics Today.
Thanks for having me here.
Yeah, really excited to have you here. Could you give a little bit of background of who you are and a little bit about Nushama?
Yeah, so I am a medical internist. I've been practicing primary care, internal medicine for many years. I worked in the city and inner city population, worked with heroin and alcohol and drug abusers. I worked on a big inpatient HIV ward for years, then went into primary care, outpatient. And over the past couple of years, I've known, I sort of got tired. A lot of my patients I got to know over many years had a lot of mental health issues, and I'd send them to psychiatrists, and many would come back on multiple different medications, sometimes 4 or 5 different medications, antipsychotics, SSRIs, whatnot. And I found that there's a deadening my patient population. Yeah. So I started getting more comfortable treating certain people myself, those, initially with basic, mental health issues, depression, anxiety. And over at the beginning of the pandemic, I had a few of my patients do some journey work, actually a little bit before the pandemic started. And I saw some incredible effects, like one person with actually not only mental health issues, but physical issues, someone with chronic migraine headaches who was suffering for many, many years, about 10 years, and tried everything, surgery, sinus surgery to acupuncture to Botox, medications, and nothing really worked, and went on a journey, a organized journey using MDMA and I think psilocybin, and was shown in the first journey exactly where the trauma was from and where the headaches were coming from. It was from a childhood trauma, and headaches completely went away. And I saw the power in this and started exploring myself and got into this work. And then I met Jay through some common friends. We're both Canadian.
Cool. We're from Canada.
I'm from Montreal. I grew up in
Nice.
Montreal.
Cool.
Yeah. And he called me one day and says, "Hey, I'm opening up this ketamine clinic. I need a doctor who's open to this work and has a passion for this work." And I did. And
have you worked with ketamine before, or was this kind of
this
completely
is the first?
new?
Yeah, I worked with, we were working with an anesthesiologist at the beginning who was working with us for many years, and so I trained with her, and then I just got into it and felt very much at peace with it. And also, I've been on this sort of spiritual journey, my own spiritual journey over the past about 16, 17 years, studying Jewish mysticism, Kabbalah. And,
Cool.
and that was my real true psychedelic experience, starting with that.
Yeah.
Changed my life. And so it was sort of a segue. I started to see the how consciousness and our mind has a significant impact on our body. So I felt that this was really mixing, helping me sort of bring those two worlds together, my spiritual and my medical.
Yeah.
Yeah.
Amazing. Thank you for sharing all that.
Okay.
So for those that are listening, we're actually here at Nushama in New York City. So could you give a little bit of background around what Nushama is?
So actually the name came, which is interesting. It came from the word, I guess, a Kabbalistic term for soul.
Oh, cool.
Nushama. And then also new shaman. So it was a play on words.
Interesting.
Which is interesting.
I like it.
So it came up. And it's about I think we have about 15 rooms, center, and a large group room. We paid a lot of attention to the setting, which is very important. I wanted to make this as unclinical as possible. Make people feel when they came in here, they weren't sick. They're not here to be sick. They're here to empower or to get better, but they're not sick. And so the place does not look like a typical clinic, an infusion clinic by any means, as you can see.
Yeah.
So,
it's nice walking in from the city. I got a little bit lost on the elevator and somehow ended up in the basement. But
oh, really? It has one of those special elevators. Yeah, if you get in, you have to press the button.
Before getting in, I didn't realize that.
Yeah,
I was like just in there. I'm like, how do I get to the next floor?
There's no buttons.
There's no buttons.
Yeah.
But walking in and being just like, that nice floral type of feel right when you get up.
You want to feel comfortable. You feel like at ease walking in here. The colors were chosen with very deep intention. A lot of people who designed this were very experienced in journey work.
Yeah.
And so a lot of intention.
And I noticed that just getting off the street and then just coming in here, like just noticing my stress level, like drop a little bit and be like, oh yes, this feels comfortable.
Create this oasis in the middle of Midtown Manhattan. It's not an easy feat.
Yeah. And then just, some really nice art when she walked in, like the wallpapering. And then you have like all those wonderful books out front there. And I loved the room idea too, with all the like luminary names, like the Watson room and the Hoffman room, Doblin and et cetera. That's cool.
A little explanation of their history and to pay, to pay respect to the people who brought all this, made this work possible.
Yeah.
We really do. We're really appreciative of that.
Yeah.
So
you guys are primarily offering ketamine treatment.
Yes.
Do you offer any other services, or is it primarily ketamine?
It's primarily all ketamine, mostly IV. We do IM. We've done some group settings, cohort. We had a few cohort groups, women in the room we're in right now. So we had six participants, and the same group followed us through the whole experience. There's about 5 actual dosing days, which were all IM. And then we did integration before and afterwards.
Awesome.
Yeah.
I want to definitely get back to the groups and talk about that. But can you explain a little bit, how the rooms are set up here? Because I noticed, you say primarily, you said IV or IM?
IV. Yeah.
And noticing some rooms have these cushions on the floor. You're not doing...
This is This is for this is just our group room we're in right now. So we can set up, probably you can get about 8 people. 6 comfortably, 8, being a little tight.
Yeah.
So we have mats on the floor and these sort of moon pods. And it's like we also do some programming in here from breath work programming. We have sound baths and things like that. And we try to do that on Wednesdays, actually afternoons. We would have that open for free for the people who went through this program. Yeah. Cool.
But I've noticed like some of the other rooms, like individual ones where it had mats. Are you doing like IM there?
Yeah. So we're doing, we do IV in those.
Oh, really?
Those individual rooms, we have an IV pole. We have these little hooks on the wall. So we have
cool.
2
Usually
rooms.
You just always see the chair. So it's interesting to have the mat on the ground.
We brought those in because some people actually requested it. That's what some people who've done other work outside.
Oh, interesting.
Plant work. That's usually the settings. We try to see if that would make people more comfortable, and it did. Yeah. It was another level below, making it a little less clinical. The other rooms we have these they're clinical. These beds that we can adjust. They're very comfortable, but it still has a little bit of a clinical feel to it. Some people like to lie on the couch, just again to make people feel as comfortable as possible during the experience.
Which is really important.
Very,
it's really important.
Huge.
And
impact.
I also heard that this is kind of like within your anniversary year. So it's been a year since you've been open.
Since we moved into this place.
Amazing. Congrats.
And we were working out of a couple of other places before that, but this really...
this is the flagship location.
This is the flagship location. It was a place, Alma, right before COVID, a place opened up. It was almost a WeWork for therapists. And they opened up, I think, just before COVID. And they decided during COVID that everything went, they closed it down. So at least we took over. So it was actually set up really in a great way for us. And we just had to change some basic decor and the room configuration a little bit. But yeah, it worked out well.
So within the past year, you've been open for a year. What have you learned? What's been some like highlights, some challenges? Just like kind of recapping the year here at Nushama.
I mean, it's been incredibly humbling. I found it more effective than I expected to be honest. In mental health, our expectations are low.
Yeah.
It's been humbling. I think the biggest challenge is learning to hold space for people to really be there. When people are going through difficult experiences with ketamine or more challenging ones, I've learned to hold space with them, to be there and not have to feel like I have to add anything and let them go through their process. That's been something I really learned, how to say less and just be more.
And so that challenge is doing less.
And not trying to intervene in their process and let them go through it.
Can you talk a little bit more about why that's challenging? Because I think that people listening, that might be like really interesting.
I think doctors in general tend to be very paternalistic. Like we have to do something. I have to be the cause of I'm healing you. Right. Actually, the word physicians doesn't even mean healer. It means teacher. So I'm not a healer, and I often tell people during their preparation, like when I do my medical intake, I talk to them about that. I say I'm not here. I'm here just giving you a tool. You're the healer. All this stuff does is just takes away what's blocking you from realizing that. Yeah, it's like a dimmer switch on the ego, on the mind, so I give them back that. Even the dosing, often I give people a dosing general recommendation, but I always discuss the dose with them. I make sure that they're part of the process. So I've learned that's been very helpful. Yeah. Not to take that away from them.
Yeah.
Yeah.
So helping to give some of that agency back to the client.
Because it really is up to them.
Yeah.
Even in medicine, I mean, it's them healing.
Yeah.
And so I want to give that back and they have to choose. It's their choice.
Yeah. Yeah. And I think that's hard for a lot of like caregivers, helpers, especially in this work. It's like you want to intervene sometimes. You want to like try to help somebody when they're having some sort of emotional or physical catharsis. Like, I want to stop this person from suffering.
Right.
But actually pulling back and sitting with yourself for a little bit and being like, why do I want to do that? Right? Why do I want to like intervene or treat this person?
Right. But I found like some of these more difficult journeys have been the most healing, the most therapeutic. So I'm learning, even I talked to you a little bit, but about spirituality, when someone's having a really bad dream and they're yelling, you're not supposed to ever wake them up during those dreams. It's not good. So the same thing during those journeys, sometimes when they are having those difficult things, and we'll go in there, sometimes I'll hold their, we get permission before whether, they're open to touch, like some minor touch, like holding a hand, or I put our hand on their chest and just have them breathe. But we work it through. The nice thing with the IV is if it's really difficult, we can turn it down or can turn it off and they start to, feel better. But I rarely do unless it's really necessary, but it's rare that it is necessary.
Yeah.
As long as you're comfortable, it's all about us. Yeah. But, some other people, I know other people have gone to other centers and they'll give them, a benzodiazepine with the infusion to prevent those. And I think some studies have shown that actually can hinder the positive effects on mood.
Yeah, I think so, right? I mean, just even going back to some of Stan Grof's work, like really advising against that for, more of this depth psychology-oriented approach, really letting that psychic process to unfold. Because if you stop it, it can continue to kind of churn in the psyche, like in the unconscious. And what we know about trauma too, right? It's like we cut that off, not processing, kind of just sticks in our body for a little bit more. So
that's the process. That's why they're here. They haven't processed it. Yeah. And so, it's all about processing. I don't even like to use, I'm trying to move away from the word trauma. It's like a difficult life event that's there to teach us. It's there for something there within every one of those events. There's a little jewel within it. You just have to go in there and go through it. And just a cloud, it's just like mist almost that's preventing you. Yeah. And just push and hold space and as long as people are in a safe place to go there and journey there, then they'll realize it's just an event. It's just an experience, and you move on.
Yeah.
So that wisdom is a memory without the emotion. So like these past events, these traumatic events, whatever it is, it's an event, it's a memory, But the only reason we have these emotions is it just hasn't been processed. It hasn't been processed and accepted and forgiven and let go of and moved on. And once you do, then it just becomes part of like what makes you strong. It's like a building block in your foundation. So I think sometimes that can be very helpful.
And I think with like these medicines and other techniques, it allows us to kind of revisit that in a way where you said kind of without emotion, right? I mean, the emotion's there, right? You have that
like
catharsis.
Curiosity. Yeah, you have that emotion. The emotion's just drawing you back to that event because it hasn't been processed. So emotion's just a messenger saying, "Hey, there's some work here. There's something here. There's a jewel. There's some cash here. Come and get it." But we get scared. You know,
the dirty pearl that we have to wipe off.
But it's there. So and then once you do, you're like, "Oh, that's it. That's all. Oh, okay." And then it makes you strong. And there'll be another challenge, of course, and another. It's how we build and grow. So,
So whenever I chat with people with ketamine clinics or just working with ketamine in general, I just always like to understand your approach, maybe why you decided to go with IV and IM, like versus lozenges, like, you know, what's the theory here and your framework?
Yeah, I mean, a lot of the initial research was done with IV, so we chose that. I think it's reassuring to know, like the IV, that it's a very smooth experience. People like to know that it can be turned off at any time, so it's not all or nothing. So if we do overshoot or the dose is a little too high, we can always lower the dose. We can alter the experience not just by dose, but also by drip rate, or stop it if they want, and that's an option. Just knowing that's an option is very reassuring. It's all about reassurance. People have to feel comfortable coming in. There should always be a little nervous, being a little bit anxious, and taking this seriously is important. But also to know that they should feel like they're in a safe place, and we can take care of them if they're not. If they feel like they're not. So that's why we went with that. The IM as well. Like if we have, some people have issues with access, like they have issues getting IVs in, or they have a needle phobia. We might go with, having a needle inside or a catheter inside of them can be traumatic and alter the experience or in a negative way. So
maybe they're just like focusing on that the whole time if they're a little bit more lucid.
Exactly. So we use that. So that's why, it just worked for us. I think there's different ways of doing this.
And I find that so fascinating. There's so many kind of different routes of administration. I always come back to something Dr. Raquel Bennett said at the Korea conference years ago. It's like ketamine is this flexible tool. And we are seeing people use it in so many different ways. And it's just interesting to kind of just see how everybody's using it, right? It's like, it feels like a very new field. And we're all kind of learning together of like what works the best and how do we approach this?
And to have respect for it though. It is a psychedelic. I mean, working with it as much as we've seen in many people here, it has a psychedelic potential. So you do have to, people are opening themselves up. And I think we have to do this with great care and respect. So, we take care. I think here I don't see it as just a medicine. It's more than that. It's an experience.
What do you mean by that?
I see this as almost like a tool that people use to sort of limit, almost like a dimmer switch on the ego in a way, and the mind. It has affects certain neurotransmitters and allows us greater access to our inner self, or our, however you want to describe it, our inner voice, our intuitive self, soul, however, people feel comfortable. So, that's all it is. And so to hold a space when you're in this vulnerable situation, an open situation, I think that the staff and everyone around here respects that idea. And and some people have this issue, having sitters. Our members sit in the, they're in the room by themselves. So we go in there. Everyone goes through a psychiatric and medical evaluation before, which takes about 45 minutes, sometimes more, where we go through make sure it's a safe option, it's a good option for everybody. And once they're cleared, we have to speak to the psychiatrist, therapist. We do all that before, and then they come in for their journeys. Their treatments. So during the process, when they come in, they have full vitals. We do, we check their, all their vital signs, go through their medications. Then they meet with the medical provider, myself, and I always discuss the dose. We go over all side effects. And then they meet with an integration coach who also sets goes over some of their intentions, does some breath work, and eases them into the experience. And then they meet afterwards. They again go through vitals and then do another nursing assessment. And then they meet with the integration coach afterwards. So to sort of make space, hold space for what comes up during the experience. We do monitor them throughout the experience.
Yeah.
But I find that in the room, people are more than happy. Like some people do need a little hand holding, and we're there to do that. Some people want a loved one in the room with them, and we're open to that as well.
Awesome.
We've had people bring a therapist with them who want to do some, but I think most, I think there's a place where, they're wearing a mask, earphones. Everyone listens to specific music that we make sure that they listen to our music.
What do you guys do for music?
We have a bunch of playlists, curated playlists that sort of, some of them were taken from, most of them from outside journey work, from some of the psilocybin studies, a whole mix. So we have about, I think, 9 or 10 different curated playlists.
Have you guys ever messed around with wave paths at all? Or
we haven't done it yet. Yeah, I've actually sampled some of that.
Cool.
So yeah, it's something that's out there.
I like it. It's easy. Like, sometimes when I was thinking, do I put playlists together or use wave paths? I enjoyed it. Sometimes I find that making your own playlists, it can get a little bit more dynamic. Right. But it is nice to just like set it, hit it, and then it just does goes. Its thing.
Yeah. Exactly. But so, and people are sensitive to the music. I think it's a big part of the experience. Yeah. It does guide them. So we have to be careful with that. Yeah, and some people will have to alter.
Yeah. So. And are you guys offering any psychotherapy services here? So are people having like ketamine assisted therapy with their therapist in the room and maybe doing psycholytic type of therapy with folks?
So we haven't been doing any psycholytic. We did have a couple of people come in with their therapist. Hasn't been our model. Yeah. I respect it. I think it's a great option. It just hasn't been I've had this feeling that I from what we're trying to do from my perspective is I want people to find their answers within themselves. And when they're in these psychedelics, experiences, to really go and dive within them and not have someone in the room that could influence them when they're in this open setting. More of a psycholytic therapeutic approach with ketamine. We use lower doses. And but that hasn't been our model. We work with a psychiatric nurse practitioner who has a lot of experience with this work. And does psychotherapy as well, so that we have that option to offer them. But a lot of people come in with their own therapist, so it gets a little complicated. We're trying not to interfere with that process. So
that makes sense.
Yeah.
And so, what are some other highlights throughout the year of getting started? And
it's been exciting. Just learning our groove and getting comfortable. Yeah, and I think learning to say less, to be more, to hold space. I think, like I said that before, working with our great integration coaches here who have been amazing, and seeing them evolve and watching our evolve and our team evolve has been really amazing. We have a great team. People really care. Yeah. And to see people who, some of them didn't come from psychiatric backgrounds, nurses, and to see how they've grown into this space and really are able to just be there for people and people feel supported. Been really, it's been a real great highlight. I'm just learning. I feel like I'm always learning. Every day I'm humbled. Yeah. The other humbling thing is every journey is different. Every person's different and every journey is different. So you go in there with sort of this amazing curiosity to walk in there and you just don't know where they're going to go. You just don't know.
I always remind people that are like entering into this field or working in this field, it's like we have to be somewhat okay with uncertainty. Yeah. Because once we think we got it figured out, start to realize it's not always set in stone.
Not at all. And also the people, sometimes there's been people who come in and I'm like, ooh, do I want to take, I was questioning whether this person was appropriate or, and some of the time, the people who I found were the most had questions the most actually really did well. And so I'm learning not to judge. It's hard for me. Who am I to judge who, this is good or bad for someone? If they're coming here, they have a desire. Yeah. Ones that are most concerning are people who are referred sometimes by their psychiatrist. They don't come here on their own volition. I think any type of journey work, any type of psychedelic work, I almost think you have to be called to it in a way. You shouldn't be coerced ever into this. So some people have asked, where are your referrals coming from? And some of them, they'll be, you're not getting, if they're not coming from a psychiatrist, you think that's right. They should be coming from a psychiatrist. And I'm like, no, I find that the ones that are really ready to do the work are finding us on their own rather than coming through, their own mental health provider, which is fine as well. But there's a coercion. And then those people see it as another treatment. They failed all these other treatments. This is just another treatment, another medicine.
It's part of the system,
and
this system's probably going to fail me again, but I'm open to it.
Exactly.
We'll see where it takes me. But yeah, there's that probably skepticism there a little bit. Yeah.
I'm trying to get them away from looking at this as a medicine.
Yeah.
I personally don't see it as that. So.
And it's interesting to just kind of hear you say that around like being called to it, because something that we always bring up, it's like, what's psychedelic informed consent? Because like, how do you consent to an experience that none of us know what's going to show up?
Right.
And to have that calling to be curious around there, I think that's important versus saying like, you need to do this, right, for your own well-being, and people being maybe ambivalent of like, I don't know what's in there, and like, is this right for me?
Right.
So yeah, I like that idea of like being called to it.
Yeah.
Because this medicine isn't for everybody,
no,
right?
It's definitely not for everyone. Yeah. It's become trendy, which gets a little concerning. Although I'm not here to judge either, but I think some people, you have to be careful. I think people have to know what they're getting themselves into.
Yeah.
You have to be open. You have to be wanting to change. And I think everyone deep inside, we all want, we're all souls. And I think it could be for everyone, but it's not.
At some point in their life, right?
Like, it's
it depends if you're ready and open for it.
Yeah. So, yeah.
So you mentioned integration coaches, and I would love to learn more about their role and what they do, and how you offer like integration services here.
Yeah, I mean, our integration, they have a coaching certificate, so they're mainly there to hold space. You know, we took a course with Roots to Thrive.
Cool.
So we did this integration course, and it wasn't a course. It was we just didn't do the ketamine portion of it, but our whole team did it with a group in Vancouver. It was amazing. And what I learned from it is just really simple. It's just is compassionate witnessing, you know, just being there and just being and really listening to people. I think is so powerful. And the 12 weeks I did that program, it was just so amazing just to have people who, the facilitators in the group were just beautiful souls, and they would share themselves. Like they were so vulnerable, and you felt like they're part of the group. They weren't these two people like, you know, on top of you, like observing you. They were just part of you. And so to get to that point where people feel like they're held and they're being listened to in a compassionate way without judgment.
Yeah.
And that's what we're trying to pose. So that's a work in progress, because everyone has their own style and their own, and it evolves as we move through it. It's evolving. So not to impose our own spiritual values and ideas on people. It's a challenge, but
I was talking to Jay a little bit. He was kind of describing a little bit about the integration coaching and, you know, how everybody kind of views integration as like lots of different things, but not really trying to do the therapy aspect of like getting caught up into storytelling, but really thinking about how do we pull from what happened in the experience, and then creating some like action or application from that, instead of getting caught up in this is about my mother, and you know, going down that biographical story route.
And they've done all that. And most of the people here have been through years of therapy, and we're not trying to go in there and re-imprint the trauma. We want to move forward, take the trauma, learn from it, grow from it, and then create a space using this medicine to learn from it and to move it into wisdom. And so that's what the coaches are there to do, is to teach them. Yeah.
And that's really exciting to hear. We get so many emails from folks of how do I get involved in this field, right? And when like you think about, a ketamine clinic, maybe they're just doing psychotherapy. Maybe people don't know that, you know, integration coaching does have a place here within these settings. And
we need them. I mean, it's, you know, I was also recruiting for that. And it's a beautiful and very rewarding line of work. I like to do it. And I also, sometimes I'll
the coaching aspect.
The coaching, the integration, like I like it actually. I wish I can do more of it.
I do too,
I can, that's my favorite part of this. And now as I'm doing more of like I do these intakes, which is also important, but I miss sometimes, I don't have as much time to do the integration. That's my love it.
There's a lot of depth there, right?
So
and
much.
Like it's
Just
really interesting. To work with that unfolding process and see where it takes people. And
it's so humbling to see people go through their process, like to really watch them transform. And I've seen some things that are just my mouth drops. I've never seen. People in years of therapy, they've been stuck. People who they came in here and they couldn't even sit in the still. They couldn't sit still. They were anxious and balled up, and they came and they transformed into something complete. I mean, not completely different, who they were meant to be. It had so much trauma and so many things that they were able to let go of over time. So I've seen some really very interesting situations.
Do you have an example of somebody with that, like, being sensitive to client information, just like a general transformation that you could describe?
Yeah, I mean, I have a bunch of them. A lot of people, and generally, actually, the funny thing is we've had a lot of people come in with mood disorders and have eating disorders, especially bulimia, binge purge. And that group has just been really, really receptive to this treatment. Like they just stop. It's just like, and it's something we can really count. Like, how many times have you been to purge this week? And it's not even something we're really working on directly, but what I've found is
so they're not coming in wanting to work on that.
I mean, not directly, more the mood and the other things. But I realized that all these things are just like they're using those things as tools, whether it's alcohol, whether it's something through Instagram for 4 hours a day, whether it's a sex addiction or gambling, whatever it is. These are tools that people are using to just cover things up, to deal with some of the pain that they're going through.
Yeah.
So when they start to deal with their traumas, their past events, those tools, quote unquote tools, become unnecessary. Like people who are smoking say, I just want to go smoke. I felt like it wasn't necessary anymore. Like it doesn't serve me. I love that. Yeah, this is the term like they use. It doesn't serve me anymore. Yeah. And that's true. That's, for addiction. I found for a lot of addictive issues, it's been very, very interesting how it's been so effective. Yeah.
And some of the original research with ketamine was around alcoholism.
Yeah, with Dr. Krupitsky, who's he's on our board. We've met with him a few times. Very, very interesting man. But they used very high doses. They would go into a very psycholytic, completely egolytic dosing, like around 2.6, 2.7 milligrams per kilogram and above. But these people were in the hospital. They had gone through a lot of, mostly for heroin and alcohol addiction. And so they had a lot of incredible preparation that included not only like therapeutic preparation, but also psychiatric preparation, but also diet and meditation and all that. So these people were really, and he found that the people who really went into these egolytic states were the ones that responded the most. And sometimes it would take one.
Wow.
He said, yeah, it's interesting. So yeah, there's a lot of work on it, but addiction is just not anything different. The addiction is not the cause of their problems. It's an effect of, so once you deal with the seed level, then those things become those addictions or those tools that they're using that might not serve them become unnecessary.
Yeah.
So they're not, I think that's important. But some of the more amazing experience, I had this one woman, very, very religious woman, amazing woman. And she married, very difficult situation. She was an amazing artist. She'd paint very realistic paintings but just completely shut down. Kids, she couldn't even function for her children. And the first time she went through the infusion, she couldn't even sit down in the chair. She kept on jumping up the whole time. I had 2 infusions like that. I didn't know, should I continue with her? But I said, I'm going to continue. And I would go up gradually a little bit each time. And finally, the third one, she really let go and she had this breakthrough. And afterwards, I walked in there and it was like seeing another person. She was at ease. She was calm. She reached her inner self. And so after 6, completely different. And she started painting this she started doing this psychedelic artwork. So she went from these painting these very, very specific pictures that are very life forms to these very abstract paintings that were museum worthy. I don't know what she said. She started painting from her soul.
Wow, that's beautiful.
And it was just amazing. If she'll let me, I'd show you the difference. It's just unbelievably. It was so dramatic.
Yeah. And
you could see her soul, in her new paintings. You can just see the release in them. It was beautiful. So
I love to see that transformation in people where they're able to tap more into that soul energy and be able to really express that. And it does. It's a very interesting transformation, especially when you can really see that in art, how that changes.
Right.
It's beautiful.
Yeah, it's very. So that was, and there's been a number of those. And then there's been the difficult ones, people who don't want to change, Yeah. And it's hard. And then you feel like a failure. Sometimes you have those and it's sometimes there'll be themes. Sometimes people will feed off each other. So it'll be difficult days. So it's just to be able to push through on those days where things don't go. You're not really, it seems like you're not helping.
Yeah.
And those sometimes are challenging, but yeah.
So some people are always asking the question, is ketamine going to be around once MDMA and psilocybin become legal? What are your thoughts?
I think it will.
Yeah. Why is that?
I think the safety, number one, you can use it. People don't have to come off of their most of their psychiatric medications, psychotropic medications. So MDMA, you have to be off of any serotonin release, any medication that affects serotonin release, SSRIs, SNRIs. So that's an issue, weaning people off for those things. It's a long journey. It's 5 hours, and it's an amphetamine. So ketamine can raise blood pressure as well, but I would imagine, the MDMA probably does so a little bit more. So there's a lot of more controls and limitations on that medication. We have more experience, in a clinical setting using ketamine. But I think they're both different. I think MDMA definitely has its space. I mean, it's a heart opener. There's some amazing, I don't think it's one or the other. There might be a place where we use both.
Yeah.
One in succession. There might be different protocols, maybe together. Who knows? I think there's a whole world. So I think they both have their place. So I don't think one's going to replace the other. I think they're very different. Same thing with psilocybin. But they're going to be a little bit harder to use, and the costs is going to be very high. That's the problem.
Yeah.
So to bring down the costs, you have to have 2 therapists in the room, and it's 5-6 hour journey. They might have to stay overnight. So the cost, I think the only way to make those work is in a group setting.
Yeah.
And even here, we're really trying to develop our groups to bring down the costs, because right now it's expensive for most. So, and then people, they need boosters, there's only so much they can afford. It gets expensive. So if we can keep we can price the groups, which I actually personally like, and the work outside I've done has been all in groups.
Yeah.
So I always like the group setting, but we can price it less than half than what we do in the one-on-one. So.
Yeah, and there's so much healing that happens in group. I think people are, and me too, I'm very introverted at times, and group work, I'm like, being around people. But there is something about being witnessed in a group, having your story heard in a group, that is very healing.
Very healing. And you learn, and there's not by chance, I don't believe there's any chance. I think sometimes the people you're in the group with, you learn from. Yeah. Sometimes they might even agitate you, and they bring out stuff that are bothering you, and you just hearing their stories, and you learn compassion for those people who bother you. And it really is very healing. I found when I've done the groups and in the big group integrations, every person, I almost learned something that I took away from from their journeys more than sometimes my own journey. So.
Yeah, and I know people can get really kind of agitated in groups when there is that transference that happens in counter, but bring it inside, right? Use that trigger as a way to be curious around your own process,
right? And
not project it out into the external world, but really bring that in. Inside.
Why is this bothering me? It's not bothering anyone else, but me, it's bothering. So there must be something there within myself that's just everything's a mirror.
Yeah. I found that to be really helpful, even in breathwork sessions where that's very kind of cathartic, lots of screaming, and I'm like, shut up. But then I'm like, why am I agitated? Right? Oh, and you go into these layers. I'm like, it had nothing to do with that person. And had to do with this feeling of safety, right? I'm feeling like that's being threatened, and you can go down rabbit holes there. But could you talk a little bit about your groups here?
So we've done a couple of groups. We did a cohort, which is the same group of people going through rather than just a drop in.
Nice.
Which was really nice. They got to know each other. They created a safe space, so you have the same people coming back, and created almost a mini community. Yeah, which is great. And and there's a big problem, especially after COVID. I think there's been a lack of community, a lot of being separated and separate. So to come here in person and to experience this in person was I think very healing.
And how many people were part of this group?
This was 6. We had 6 people.
Nice. That's a good number.
Yeah, it was a perfect number. It was a great number. And we did some, initial meetings in person. Then we did a Zoom meeting before each one. And then afterwards, we'd have a live, right after each treatment, we'd do a live integration circle. We had our integration coach, and we had a therapist, like a LCSW, come in. And it was amazing. I mean, it was really amazing. And then 2 days later, we do another integration, a Zoom integration virtually.
Awesome.
And
were these people like doing individual treatment first and then they moved into the group?
So
or it was
some
just,
did. Most of them, I think 2 of them came from individual treatment and 4 of them were new to it.
Okay, cool. They just jumped right in.
They jumped in.
Oh, that's cool.
So, yeah.
I know some people will need to work with them individually before entering into the group.
Right.
Which has its benefits. But,
right. And I think eventually, we'll have a group, more of a drop-in type thing for boosters rather than people spending more money on boosters.
Because that makes it way more accessible.
Yeah.
Right?
Yeah. And then you have the added benefit of groups. Yeah. I think that's a whole healing modality in and of itself. So.
And how many people can you fit in here? I see.
I'd say we have these are spaced out. We can get 4. I think we can get 4 on each side.
Okay, cool. So about like 8.
Yeah, 8 would be comfortable. Maybe another 9th, but yeah. So that's very cozy in here.
Yeah, it's nice.
It's nice. Yeah, I think they did a good job. And then sometimes we use this as a step down room when people need a little more time to, after they're coming out of their individual sessions, we come in here. Sometimes people can rest when we're not using it for groups.
Awesome.
Yeah. So, yeah.
So it sounds like you guys are going to continue with that group work.
So the groups, we'd like to continue.
Yeah. So you'll have a cohort-based model, but then you'll also
we're also going to do drop-in. So
ultimately,
we'd like to really build that up. I think so to serve more people. I think it really makes sense. And as we do more of the boosters, people coming for the boosters, I think it'll be really good to have both of those options available to people. Yeah. So
because this is everybody's kind of critique around psychedelic medicine. It's like, how do we make this accessible?
Yeah.
And I think doing group work is probably where it's going to be. And group work with psychedelics is interesting, right? Because I feel like people can become really sensitive to the environment. But with ketamine, I guess you're probably a little bit more quiet than say psilocybin or MDMA. Right. But yeah, I think that's probably going to be part of the future.
I think it's going to be mostly groups. I think it's the only way to do it. And I just think, and when you open yourself up, you realize you're not alone in this.
Yeah.
Which is a nice feeling. Like when people get rid of the ego and there's this sense of interconnectedness that you just feel. You just feel people in the room. I think it's natural. Naturally, I think it's meant to be done in groups.
And I guess if we look traditionally, right? We were all part of groups and tribes.
All the tribes, for thousands of years, they've been doing it only in groups. So, and
I think there's something too around the peer support that comes from that, right? Versus like being in individual therapy, which I think is important for very severe trauma. You need that like relationship, that security, and maybe depending on where the person's at in their process. But then I think there, you get that, power differential there in the relationship. Right. But when you come together as a group, right, you get this nice peer support thing. You're able to like go through it and together in an interesting way versus like just the therapist there helping you go through it.
Right. And you become the integrator.
Yeah.
And everyone else is part of the it's like, it's community.
Yeah.
Yeah. I think that's so, I'm a big fan of that. And almost all so.
And what are you guys doing here to help build community? Because I think that's a big part of
some of those Wednesdays. Healing. So on Wednesdays, we were having these groups. We were offering for free to our members who went through the program. Breath work. We'd have the holotropic breath seminars. We had cacao ceremony. We had a sound baths. So that has to be really, that's something I want to build up on as well, to have these groups to get together. Also, aftercare program. This is another thing I really want to work on is aftercare. I think people are always questioning like why, how long does this last? This is a big question. This is and I think it's how much time and effort you're willing to put into the work afterwards. It's just, the actual psychedelic experience is just one tool, but you still have to do the work. This is not like, it's not doing the work for you at all. And I think people make that big mistake. I'm going to come in here and do a psychedelic experience and everything's going to be perfect. Not at all. It just awakens, an awakening. Yeah. So you listen to yourself. You can listen to these tools. We're not trying to suppress those I call them messengers. Depression, anxiety are just messengers. So, to do the afterwork, and also take care of yourself physically. Exercising, doing yoga, meditation, building up a meditation practice, spirituality, whatever that means to people, reading things, whatever that go along with this new version of yourself you want to continue with. Yeah. So you have to put some work eating proper nutrition, eating healthier in a way that you care about the body and care eating processed foods. It's just, you don't care. Less drugs, staying away from other daily use of medications. So you don't need to suppress as much, maybe less. Like I've found doing this work plant work, just not as drawn to certain types of like alcohol. I just don't drink as much since then. Just not that it's bad or good. I have no judgment or smoking weed. It's not as necessary. I'm just happy being. I don't have to be in an altered state because you're sort of high all the time. That's the beauty, I
think that's what a lot of this work has really taught me, is how to just try to be here in the moment, because the magic is here in each moment. And it's made me appreciate things a lot more.
Yeah. Without having to be in an altered state when this state is great. It's beautiful. I mean,
my teacher Lenny always he comes more from the philosophy background, but he's been really kind of critiquing this term integration.
Right.
And it's very kind of Newtonian Cartesian of like, it's separate, right? This is a separate experience that happens versus we're in it all the time.
Yeah.
And so saying that I need to integrate this experience is actually creating a divide and not being able to actually see that this experience is also part of this moment.
Right. So true. I mean, I think sometimes you could ruin their experience, like having people verbalize what comes up. It's limiting. It's like what they experience is so otherworldly, and you come in and start putting words to it, and then you bring it back down here. So I think, like we said, like sometimes integration might just be holding space, just listening, or just being there in the room and just being there. So that's something also I've realized. I think sometimes we can trying to take credit for it. And some of our own ego gets involved in the whole process.
Yeah.
We have to stay humble. That's the best thing to be an integration or whatever you want to call it, a coach, or to just be someone who's there holding space, just to be there and not have to feel like you have to do anything.
Yeah, and I think about it when I'm just thinking about like breath work and some of my own experiences where somebody's just sitting there and not doing anything. Because like, when do you actually have a time in your life where you get to have your own experience and really have the agency and going in there and not being intervened? Because even in friendships, right, your friends like upset and, you want to put your hand around them. And so it's like, where do you have like this, like just this experience where somebody is just there with you?
Right.
And I think, again, going back to my teacher, Lenny, he always kind of said, who did you need when you were dying on the mountain? So for reference, I had a near-death experience snowboarding. And it was the person that didn't say much. It was the first responder that just gave me, simple, like, hey, we're here, we're doing this. But they just did not say much. Just little simple reminders, and they just had this presence of like, we're here with you.
Yeah. Don't
need to overwhelm you. I don't need to like, ask you a bunch of things. I'm just here with you.
Yeah. Beautiful. That's amazing. That's integration.
That's hard to do.
It's very hard to do.
Very hard to do. We want to, be there.
Yeah.
I think we're getting at time. Yeah. So anything, I'm wondering, what's the 5-year, 10-year vision for Nushama? What are you guys doing?
Yeah, we're looking to maybe expand, have other centers like this, maybe more groups. I think expanding the group, and then integrating other other medicines as they come available, and if it makes sense, bringing anything in that makes sense to help people. So whether it's MDMA, psilocybin when it comes, or whatever it is, hopefully that'll will create a space where those things will just naturally sort of flow in and. Yeah.
And are you guys planning on expanding outside of NYC?
Yeah, I think their plan is eventually to go outside, maybe East Coast first, and then we'll see where it goes. Yeah. But I'm enjoying this one right now. I'm learning, you know.
Yeah.
So
cool. Anything else that you want to close with? Maybe you didn't say, or anything that feels unresolved?
No, I think just the most important part of this work for everybody doing it is just to be humble, be really, really humble, remove yourself and just be with people, and learning, like, sometimes saying less is really, that's all you need to do. Yeah.
It's a wonderful reminder.
Yeah. So.
All right. Thank you for your time.
Thank you so much. I really appreciate that. It's great talking to you.
Yeah.
So, yeah.
All right. Until next time.
All right. Welcome back, everybody. I hope you enjoyed that episode with Dr. Steven Radowitz from Nushama. Again, if you want to learn more about Nushama, you can check them out at nushama.com. That's nushama.com. This was a really fun episode. I'm glad that more in-person interviews are happening, whether it's at conferences or being able to actually go to a center like this and sit down and record in person and actually see the environment. It just adds a different level to understanding the work. So glad that is starting to pick up and it's not just all through Zoom and an online interview. So hoping for more in-person interviews as we move forward here. If you have any questions, comments, anything like that, feel free to send us an email, info@psychedelicstoday.com. And just some reminders again, if you aren't following us on any of the social media platforms, check us out, Instagram, Facebook, TikTok, Twitter, to get updates. Always posting updates on there. So be sure to follow us there. And if you haven't subscribed to the podcast, definitely subscribe to the podcast wherever you listen to podcasts. So I think that's it, everybody. I hope you're having a beautiful day, beautiful week whenever you're listening to this, and we will catch you on the next episode of Psychedelics Today.